Hi everybody and welcome back to lecture. Today we're going to take some time to focus on incarcerated women and what it's like to be a female offender living in prison. Throughout the semester what we really have been focusing on is the traditional male experience because male offenders just simply outnumber female offenders in the correctional system. Really, when we're talking about that, it's a statistic of more than 93% of all offenders being male. So we're talking about a very small proportion being female. So it makes more sense in a general scheme of things to be talking about the male experience a little bit more because that's what's more commonplace. However, what we need to talk about is the female experience. And overall in the correctional system, because the number is so small, we just simply have less of a need for female-specific institutions and female wings within local jails themselves. So even though we're talking about female offenders in a very small scope, and we're talking about a prison population that is much smaller in number than incarcerated men, what we're seeing currently at least, is this really, we'll almost call it an explosion of female criminality. And statistically speaking, I guess I'll say, we're seeing a sort of substantial increase in the number of women who are being incarcerated compared to numbers that we have seen in the past. And what we're really seeing in from about, I think, like 1975, 76, 77, somewhere around there, up through the mid-2000s, over a 700% increase of incarcerated women are going to prisons and jails. And when you break that down based on race, you're seeing some very vast differences. So within that same time period, black women are being incarcerated at over 800%, but for white women specifically, it's only around 500% of an increase. So still really substantially large, but we're seeing that racial disparity still take place even among women. And we've sort of talked about that already among male inmates, but we're seeing that take place with female inmates as well. So a lot higher than we've ever been seeing in the past, but it does differ based on races. But the one thing that many of these women have in common are the types of offenses that they are committing. So women commit their offenses very differently than men. A lot of the crimes that women commit are considered pink-collar crimes, so things that might be out of economic need or necessity, like writing hot checks, stealing for their children, that kind of thing. I mean, they're still doing other types of crimes that we typically associate with men, but they normally might be doing it for other reasons, or their motivations might be different, or the way in which they're committing the crime might differ as well. But one of the big things that is really sort of influencing or having a large role in the number of incarcerated women, or that large percentage increase we're seeing, is the prescription pill industry. So we're seeing a lot more drug offenses for women than we've ever seen in the past, and unlike men who are normally more partial to harsher street-based drugs, women are being incarcerated a lot more often for prescription pills. So that's where you're seeing, especially at the federal level, you're seeing a lot of growth due to drug offenses. Still at the local and state level in some ways, but a lot more at the federal level due to the nature of the drug offenses. But regardless of where they're being incarcerated, whether that's at the local, state, or federal level, what we're seeing is that women are just having a more general, their incarceration experiences just generally differ from men. The way that they behave with other inmates, the type of facilities that they are in, the type of educational and treatment programs that they're being exposed to, all of that is very different than the male experience while men are incarcerated. But if you really think about it just in terms of how different men and women are on the outside and the different things that we have to deal with compared to men, a lot of that carries over to the incarceration setting as well. So just think about the number one thing that women have to deal with every single month, right? Their periods. In a male institution, this is never a concern. So within male budgets, there's no money set aside for feminine products, for anything like that, and then carrying that over into pregnancies. Male prisons are not equipped to deal with this. They don't have it in the budget, and there's really no need for it, right? But in female prisons, they have to account for the specific nature of the female body. In particular, if you think about pregnancy, on average about 12,000 women are incarcerated while pregnant, and will eventually give birth while they're in an incarceration facility. Whether that's in a jail or a prison, it doesn't matter. The babies are coming and they are being sorry, I almost knocked over my drink there. They're coming and they're being born into the correctional system. But just because women are incarcerated and pregnant doesn't mean that they are necessarily treated any different than the women who are not pregnant while incarcerated. They're still subjected to the same prisons or conditions rather. Many of them are still in general population. They're still required to work. They're still subjected to the same security concerns. They're just simply pregnant and they're receiving prenatal care at the same time. So I'm pregnant and I'm incarcerated, and eventually I have to give birth. And giving birth while incarcerated is kind of a mixed bag. So depending on where you are incarcerated at, the physical location of your jail or prison, you might be at some place that has the facilities for you to give birth inside the facility. You don't have to go to a separate hospital. But for many women, they do have to go to a separate hospital. And if they are giving birth outside of the correctional facility, one of the things that happens is, and it's not all states, but a good majority of states still allow for pregnant women to be shackled while they are giving birth. So their hands are shackled to the rails and their feet are shackled to the rails as well, in some cases. So I don't necessarily know about you guys, but having a baby is hard work. And the last thing that you are probably thinking about doing while you are in the midst of full-blown labor is trying to escape the hospital. You probably would not get very far. So having states require women to be shackled is probably a little redundant and probably a little unnecessary. But 32 states currently have legislation on the books that mandate that women be shackled during labor and after the child is born as well. But we are one of the only countries in the world that still does this. And for many, they consider the practice to be dangerous to mother and baby and just vastly inhumane. Childbirth is a very natural, very stressful, there's no other word for it, a very stressful process. And to have the additional strain on you from being restrained to the hospital bed is just sort of this assault on human dignity, if you will. And in addition to that, it's just an unsafe medical practice. But here in the United States, we routinely see female inmates being shackled to hospital beds during their labor and delivery. But it's unsafe all the way around. Not only does it pose a threat to the mother, but it also poses a threat to the fetus and increases the potential for miscarriage in some cases, or stillbirth in other cases. But labor and delivery and postpartum recovery are just very, like I said before, very stressful. It takes a lot out of the new mother. It takes a lot out of the baby. It's just this giant ordeal and sometimes trauma in cases of cesarean section. So shackling often can interfere with doctors' ability to provide adequate medical care, the mother's ability to actually give birth to her child, and then the health of the mother and the newborn afterwards. But once the baby is born, what we see is that the baby is often taken away from the mother almost immediately. In some cases, the mother might not even be allowed to hold the child. Some states allow the mother and child a few hours together, but typically the child is taken away then very quickly afterwards. The child then where does it go, right? So maybe the father is around, maybe the child goes to the father. There's the potential for him to also be incarcerated, so perhaps the father is not there or not in the picture. Is there a relative? What about the mother's parents? Can the grandparents take the baby? Is there another close friend or relative that might be able to take the child while the mother finishes out her incarceration sentence? I don't know. If there is no guardian or custodian of the child, then the child might have to go into the system, and that's not something that anybody wants. So some states have started doing this thing. I call them Mommy and Me programs. States have different names for the programs depending on what they want to call them. But I think Mommy and Me sort of encaptures what the programs are all about. But these programs basically are for short-term inmates or for inmates who just have a, less than a year in their sentence, or less than a year left in their sentence, depending on, what stage of pregnancy they came into the prison at. And basically what it is the mother is then allowed to keep her newborn with her inside the incarceration facility while she finishes out the remainder of her sentence. And these are very controversial, let's call them, types of programs. But basically what it allows is for the mother and child to remain together for these very short-term sentences. And it allows the mother to care for her infant without putting any additional burden on the state by forcing the child into the foster system. And not only that, but it allows, right after the child is born, it's one of the most important times in which the mother and the baby need to bond and to grow that relationship together. So it's just a very crucial time in the beginning stages of the infant's life. So to be able to keep mother and child together not only is cost effective, but also strengthens that bond between the mother and her new baby. But it's very difficult to get into one of these programs. There are not a lot of spots. It's in a lot of states they're still in the beginning stages of testing these programs, and taxpayers are not real keen, I would say, to be throwing money at these programs, which essentially allow an infant to remain in an incarceration facility for a while. And you have to be a non-violent inmate. So there's a variety of different hoops that you have to jump through before you're even eligible to get into one of these spots. But once you do get into one of the spots, what happens is that the mothers who are in the program are the primary caregivers for the child. They're the only ones who are taking care of the baby, and the prison oversees it to make sure that I'm not doing anything that is harmful to my child, that I'm not neglectful of my child, and that I am being the best mother possible. But like I said, these are wildly controversial still at this stage, and they've been around for a handful of years now, but still people are just drastically and wildly opposed to these programs in general, because maybe I don't feel like these women should get special treatment over the other women. Maybe I don't feel like a baby should be exposed to the conditions of these prisons. But remember, we're talking about infants, like freshly born, newborn infants, who are not going to be retaining or remembering this stage in their life in which they have lived inside this incarceration facility, whether that's a prison or a jail. And remember, these are women who are just about ready to leave the system anyway. And these programs really work to keep the mother and the child together so that the baby doesn't have to enter the system. And when children enter the foster system and are wards of the state, we know that that comes along with a variety of other consequences and can lead to future criminality or increased likelihood of criminality for that child down the line as well. So it's about the importance of keeping the family structure together. Because the other thing that we have to remember is that women are often more likely to be a single parent or the primary caregiver compared to men, and women who are in incarceration settings are more likely to be a parent than incarcerated men. So if we want to keep families together and we want to decrease the likelihood that this child might also experience criminality down the line, why would we not try and offer some of these programs and expand them a little more and let the women take care of their newborns? it seems to me like it would probably be a pretty good endeavor, and keeps everybody intact. So, but that's just my 2 cents. So I don't want to spend a lot of time talking about this today, because I felt like the primary focus and what I wanted to talk to you guys about was the status of motherhood within an incarceration setting. And of course, there are a variety of other things that are happening in female-specific prisons, that don't necessarily just touch on motherhood. But I didn't want to spend too long talking to you guys about things in lecture today. So next week what we're going to do is we're going to jump to our very final week of our specialty inmate topics. And next week, what we're in that topic week, we're focusing on sex offenders, we're focusing on mental illness, and we're focusing on the elderly in your readings. But in particular, in the lecture, what I'm going to do is focus primarily on the elderly and on sex offenders, because I feel like we've already talked a little bit about mental health this semester in conjunction with our solitary confinement lecture, when we were talking about security and risk levels. So I'm not going to focus as much on that in lecture this week. So meet me back here next week when we finish our very last week of specialty offender topics, and then we're going to jump back into our more specialized lectures when we focus on, I think it's parole and reentry that comes after that. So thank you guys for your time and your attention today. I hope you guys have a great rest of your day, and I will see you next time. Thanks. Bye.